Pharmacology of antibiotics. The anti-infectives. Anti-infective agents are drugs that are designed to act selectively or foreign organisms that have invaded and infected the body. Anti-infective range from antibiotics, antifungal, antiprotozoal, antihistamine. Spectrum of activity of anti-infectives. Narrow spectrum anti-infectives affect only a few bacterial types. The early penicillin drugs are example. Broad spectrum anti-infective affect many bacteria. Meropenem is an example. Because narrow spectrum antibiotics are selective, they are more active against those single organisms than the broad spectrum antibiotics. Common adverse reactions to anti-infective therapy. The most common adverse effects are due to the direct action of the drugs in the following organ systems: neuro, nephro and GI system. First, nephrotoxicity. Antibiotics that are metabolized and excreted in the kidney most frequently cause kidney damage. Most common adverse reaction to the anti-infective therapy in gastrointestinal toxicities, direct toxic effect to the cells of the GI tract, cause nausea, vomiting, stomach pain and diarrhea. Third one is CNS toxicity. When drugs can pass through the brain barrier and accumulate in nervous systems, they can interfere with neuronal functions. Fourth one is hypersensitivity. Most protein antibiotics can induce the body's immune system to produce allergic response. Drugs are considered foreign substances, and when taken by the individual, it encounters the body's immune cells. Fifth one is the superinfections. Opportunistic infections that develop during the course of antibiotic therapy are called superinfections. The penicillins: narrow spectrum penicillin, penicillin G and penicillin B. Broad spectrum penicillin, amoxicillin, ampicillin and vancomycin. Penicillinase resistance penicillin and extended spectrum penicillins. Beta-Lactamase inhibitors. The penicillin is a medicines that comes in the beta-Lactam antibiotics group. Penicillin produce bactericidal effects by interfering the ability of susceptible bacteria from biosynthesizing the framework of the cell wall. The bacterium will have weakened cell wall, will swell and then burst from the osmotic pressure within the cell. Amoxicillin is well absorbed in the GIT. Therapeutic indication of penicillin are indicated for the treatment of streptococcal infections. Adverse effect of the penicillin: GI system effect. The major adverse effect of penicillin therapy involve the GIT: nausea, vomiting, diarrhea, abdominal pain, glossitis, stomatitis, gastritis, sore mouth and fury tongue. The reason of some of these effects is associated with the loss of bacterial flora, hypersensitivity reactions, rashes, pruritus, fever. These indicate mild allergic reactions. Wheezing, the diarrhea may also occur. Anaphylaxis can also happen, leading to death also. It occurs in 5 to 10% of those receiving penicillin. Pain and inflammation on injection. Nursing implementation. Obtain culture and sensitivity testing results. Check if the penicillin is the drug of choice. Monitor the renal status and function regularly. Administer the correct dose. Stress the importance of the completing the full course and the duration of the therapy even through the patient experience relief earlier in the treatment. Monitor site of the infection and the sign and symptoms related to the drug administration. Provide small frequent meals. Provide oral care every shift. Provide patient teaching. Tell the patient to drink a lot of fluid, eat nutritious food. Advise to report difficulty of breathing, severity, diarrhea, dizziness, weakness and vaginal itching. Evaluation: monitor patient response to therapy and monitor the effectiveness